morning. It's Friday, June 23rd, and time for another legislative update from your North Carolina Medical Society. We're racing to the end, and thank goodness this session is about to come to an end. We passed a budget this week, and it's now on the governor's desk for his consideration. We've reviewed that with you in past weeks, but overall, the healthcare section of the budget looks really good. We were very fortunate this year to make sure that we got money for GME, money for opioid training, no Medicaid rate cuts, no significant policy changes in the budget. So we're very happy with the Senate and House budgets and the way they came together in a conference this year. This week has been the week of gutting bills and changing them into something completely different. And that happens every single year, and everybody loses their mind about it, but this is just the way that things happen down the General Assembly when things get tight towards the end, and we've got to find a vehicle, have to find a bill that's already been used somewhere else or already passed in another form, and turn it into something so that we can have a consideration of a topic. This week, two bills were in Senate Healthcare Committee that started out as something and ended up as something completely different. The first one was an eyeglass bill that was included in the state budget, and so therefore became a vehicle that could be used for something else. It turned into a bill about Medicaid reform, about how we're actually going to set up these prepaid health plans that are going to be the new managed care entities in Medicaid reform. The one significant issue that we saw in that is that it listed a number of Chapter 58 provisions that would apply to these new prepaid health plans without mentioning the fact that the Chapter 58 protections that we want for patient and provider protections were left out, not acknowledged in any way, shape, or form. So we've been talking to senators about fixing that. We're also trying to fix that in House Bill 403 that we've talked with you in previous Bowtie briefings about. But somewhere along the way, we're going to make sure that those protections remain in the law as they were passed in 2015. The other thing that passed this week was another bill that had already been passed in another format that was turned into a naturopathy licensure study. This was a different study than what we've seen before. This one is one that was only going to have 5 people included in it. The Secretary for the Department of Health and Human Services, 2 naturopaths, a doctor from the North Carolina Medical Society, and a doctor from the North Carolina Medical Board. There is an effort within the General Assembly to make sure that naturopaths receive licensure so that we can get rid of the folks that are claiming to be naturopaths and hurting people all across the state. And that's something that is very important to us because, as you know, and we've talked about many times before, we were started in 1849 to make sure that the charlatans were not ravaging the state and hurting the citizens of North Carolina. So we've been integral in negotiating with the naturopaths, trying to make sure that there was a proper training, that was a proper scope of practice, that there was proper oversight, that they could actually regulate their group in order to get rid of these charlatans that are out there. This study is supposed to finish that out and then bring a recommendation back to the North Carolina General Assembly. It's an odd study that usually goes to LRC or it goes to some kind of General Assembly study group. So I'm not sure whether this is going to continue to move forward or not. But either way, this is an issue. This is a scope of practice issue that we continue to work on. It's going to be around for the end of this session and into the short session. So this is something we'll be constantly keeping you up on going forward. We'll probably see some more bills like this changing, coming out at the last minute, especially as we see committees beginning to shut down, because it's already been announced that we're going to be working next weekend and trying to wrap this session up before the July 4th holiday. But simultaneous to all the busyness going on here in North Carolina, look at what happened yesterday at the federal government. Senator Mitch McConnell and the other senators in the U.S. Congress rolled out a new health care reform bill. And this one looks strangely similar to the House version, when we thought that they were going to be making modifications that would make it somewhat better and not have the insufficiencies that we saw in the House version that came out. So we find significant problems with this bill, as many other organizations have already been finding out there. Even before the CBO report has come out, even before the markup process has begun, we believe that there are a lot of changes that need to happen in order to make sure that not only does this bill do what the Republicans senators are wanting it to do, which is to repeal portions of Obamacare, but that it doesn't mess up Medicaid at the same time. This bill has gone from changing the law that is out there that they say they have significant problems with, to really meddling in a whole nother area and setting us up for a really dangerous future here in North Carolina by block granting and setting up Medicaid in such a way that all the burden is shifted down to the state. And while the state may have more flexibility, there always come strings with federal money. So I don't believe that the flexibility justifies the fact that we're going to get squeezed, and the pressure point on the money for future Medicaid coverage is all going to be resting here on the state's shoulders. So we're going to be asking for changes. We're going to be working with our counterparts in the hospital and business community and insurance community to coalesce around a message going to our state senators. But we want you to have the opportunity to talk to them also. So we're going to be opening up a unique action alert today for you to reach out to Senator Tom Tillis and Senator Richard Burr and tell them what you think. I know that you're reading the newspapers. I know that you're reading blogs and all the different things where you get information as well as what we're sending you. And we want you to write your thoughts to Senator Burr and Senator Tillis instead of using a canned message from us. So we'll be putting out our statement and then opening up an action alert that will be a blank page for you to write to them and let them know your thoughts and how you would like to see them take care of your patients and your future in caring for your patients. So I hope you'll take that opportunity. This is something unique, and I know it's going to be a little more time consuming than the usual 3 clicks to do an action alert, but I think this is important that they hear your personal story, how this bill is going to affect you and your patients at this time, because they're talking about running this next week, doing a quick review, markup, and passage of this bill. So they need your thoughts right now. So until next week, when we try to wrap things up, I hope you will take the time to write your senators. Look out for more information on the legislative blog about all the bills that are moving and the crazy changes that are occurring to some of those bills along the way. And we'll try to have a full wrap up as we near the end of session for you next Friday. Have a good one.